Good evening. Welcome to Mary Washington Healthcare's monthly recruitment conversation. Thank you for joining us. My name is Darla Burton, and I'm the Director of Recruitment, and I get the distinct pleasure of introducing you to our team this evening. Tonight, we want to focus our career conversation on Mary Washington Home Health Agency. With us this evening is Linda K. Grice, who serves as our clinical manager over home health. Linda is a physical therapist by trade, and she began her career at Mary Washington Healthcare approximately 30 years ago. Joining Linda is John Perret, who has been with home health for 9 years. Although he has 20 years of physical therapy experience in various patient care settings, he has remained in our home health agency setting for the last 9 years. Susan Crane, who has been a registered nurse for over 25 years and is originally from Canada. She has brought her home health experience to Mary Washington Healthcare and has been with our team for over 14 years. Please keep in mind that this Facebook event is a career conversation, so we ask that you submit questions throughout the program. You can submit those through private message or through in our chat during the conversation. We will try to respond to all questions live. However, if we are unable to answer during the event, we will follow up via Facebook later. Without further ado, I'd like to introduce you to our team. Linda.
Thank you, Darla. As she said, I've been with Mary Washington Home Health Agency for 30 plus years. I started out as a pay-per-visit physical therapist after my first child was born. I started the LPTA program in the home health field in the area. I stayed out in the field for approximately 15 years, and then I transitioned to full-time after my kids were grown and more independent. Then I transferred into management, and that's where I am now. Starting as a field clinician has given me good insight into management and helped me be more effective as a manager. We have PT and PTAs. We have a ratio of about 1 to 2 LPTAs per PT, same with the OTs and the CODA ratio. We have nursing, speech therapy, social work, home health aides. We are a hospital-based agency. We've been in about 35 plus years. We're not for profit. We service a very large area, approximately 100 miles. However, we have divided into teams, into smaller territories, so we have all disciplines focused in smaller territories that hit the counties, the local counties in the Fredericksburg area. Now I'm going to turn it over to Susan.
Thank you, Linda. As Darla said, I've been with Mary Washington about 14 years. I started, I've been nursing 25, did 8 years in the hospital, and actually never quite thought I would end up in home health. However, a turn of events in life landed me in South Carolina, where I started my home health career. And another move brought me to Fredericksburg, where I was welcomed with open arms to Mary Washington Home Health, having worked on the same computer system, and have stayed here ever since. Love my job. We are a multidisciplinary team. We enjoy communicating with each other. We hold team meetings. We brainstorm about our patients on a regular basis. You're never alone out there. It is the kind of nursing that if you're someone who's worked in the hospital and ever wondered how that patient was going to do when they left, how their family was going to manage, this is how you find out what happens. This is how you learn the challenges of people living in their home. Our goal is to keep them in their home. Our goal is to keep them safe and work with, again, all the other disciplines to ensure that that happens, to keep people as comfortable as they can be and educating them. It's a constant teaching about disease processes and medications and just making them as safe as they can be in their own home, which is where typically people want to stay, and that's where they're the happiest.
And my name is John Perret, as Darla had mentioned, and I had moved to Virginia from New Jersey. That's where I grew up, but my wife's from this area, so we decided to move here. When we did move here, I was fortunate enough, I had multiple interviews. I probably got, God blessed me with at least 7 or 8 job offers. I was originally in an outpatient setting. I'd also worked for sports teams and some other places. And I quite honestly never thought I'd work for home health. It was one of my least favorite things as a student, and I always said I'm never going to do that. So, but for whatever reason, when I got here, I actually interviewed with Linda and another lady by Carla, who's now retired. But they just kind of wooed me in, and they made me feel really confident that I was going to like what I was doing, that I'd be able to use all my experience from other settings and enjoy it here. So at the time, I had 2 little girls. They were 4 and 5. So the flexibility too that Linda was able to offer with the job also helped with helping my kids, because my wife works full-time also. So we were able to incorporate some of my personal needs and kind of melt that with some of my professional desires, and it really worked out well. So 9 years later, I'm still here. I really enjoy it. I kind of echo Susan's sentiments about really make an impact with the patients almost right away. They are very appreciative. One thing I find in this area, especially Fredericksburg, is, and some of the rural areas just outside of there, the people really appreciate you being there. They do what you ask them to do, pretty much. There's always those outliers, but they really do, and they get a lot of benefits. So I think every day is a new day, and every day I put my head on the pillow at night, and I really feel like I made a difference. So I think that if you're even remotely thinking about home health, this is a great place to go.
Great. We have a couple of questions that have come in. Please continue the conversation, ask your questions in our chat, and we'll try to get to everyone. One of the questions that we had was, how much experience do you require to work with your agency?
As far as experience required, for nursing, we prefer to have at least 1 year of acute care experience. Because home health is very autonomous, you need to have that experience of having somebody at the elbow, on the floor, or in some kind of setting where you're not by yourself. It doesn't necessarily have to be home health experience, but in fact we prefer, the more acute care experience. It's not a job for a new grad right away, because you need to have that experience to develop your skills before you're on your own out in the field.
Excellent. All right, another question is, and this probably is for you, Linda, how do you create a team when everyone is really working out in the field?
It is a challenge in home health, but I think we incorporate a lot of team building. We have team meetings on a weekly basis. We rotate between the 2 teams. We bring everybody in for monthly meetings. We do nurses quarterly meetings. We do rehab meetings. We try to do a lot of, because we are out in the field a lot, you don't see each other as often. We try to do some more fun things and have people, off-site as well. There's the OTs get together and do a lunch on their own, and, they kind of brainstorm about different, problems that they might be having and pull from one another. So each group, even though the teams are multidiscipline, we meet those teams together, and then we also pull the individual disciplines, for some team building as well.
Do you have current job openings?
Yes, we do. Currently, we have 2 full-time nursing positions open. We have a full-time PT position as well that has a sign-on bonus. We have a new position that we're starting, which is our LPN position, which is going to be more of a in-house position, and it's more support for the nurses out in the field and communicating with the doctors and with the patients' families, more of a communication tool to help pull together some of the communication, because the patients are out and about. We want to try to, give them a central person to contact when they need to get in touch with us. That's always available. I know Susan discussed there is somebody always in the office. We have 2 supervising nurse supervisors that are at the phone all the time. If you ever have a question, no matter if it's PT, OT, speech, social work, home health aide, nursing, they're your go-to person. So they're always there available for you.
And can I just go back to what the question about how do you create a team? Because I think for the most part, we work in a smaller territory, so it's usually the same clinicians that are working together with a particular patient, particular family. So you know who's in there, you know who's involved. We get to know each other. We know we can always communicate back and forth. If there's an issue, people are upfront, and if it's a nursing issue, they will call us up and say, this is what's going on, can you get out here to see so-and-so? So there really is a lot of communication back and forth to ensure that there is good care coordination between all disciplines and everybody involved, and to keep the family involved in the patient's progress, in patient changes, trying to anticipate any issues that might come up so we can prevent kind of any unwanted rehospitalizations, emergent care visits. We really work hard to keep people at home.
And I think too, as a team, we communicate very well on the field too. So I think I like, if anyone's thinking about it, anyone's nervous about being alone or not having a lot of communication, because that was a little bit my trepidation when I first got on board. But I have to say the team in the office, for one, is constantly available. I've never seen, their whole attitude is do what you got to do for the patient first, and we'll figure it out on the back end, and then we correct with team meetings and other things. Between texting on the phone, emails, either between management or between each other. If something happened in the house that was a concern, we can instantly get a hold of somebody and get a hold of each other, and it really makes just the care for the patient that much better. But it also you're not alone. That's the one thing I'm just trying to say to you guys. You definitely have a team sense here, even though you're in the house a lot by yourself with the patient, you're never alone.
John, we had a follow-up question to your earlier statement. John, thanks for caring for our patients in the community. You stated it's easy to lay your head down on the pillow at night. What does that mean? Am I hearing you love what you do and you feel you were able to provide safe, quality care?
No, I'm just exhausted. And I have kids, so that's part of the problem too. But that's exactly it. I always feel like that. That you do. I really feel like you put some effort into it. You know how sometimes jobs you put effort into things every day and you feel like you get nothing out of it. Well, for this, every time I feel like I put effort in, there's always a benefit that I feel like, at least in some small way, and a lot of times in a big way, you really help someone. Sometimes you even help save their lives, to be quite honest. I know everyone here on this panel has had to call 911 to send a patient to the hospital, and we found out on the back end that call literally saved their life. So I don't say that to scare anyone. I say but that is a great position to be in, and it allows us to really make a difference. So
That's excellent.
thanks for that follow-up.
Well, I think one of the benefits that I find in home health is the personal interaction with the patient. You don't only get to know the patient, you get to know their family, you get to see their actual living situation. It's not a staged set of stairs, it's not a staged bed getting in, it's actually where they live. And sometimes the simplest little thing that you change allows that person to stay in that home independently, which is what they want to do, and you become part of their family almost.
And they give you like homemade baked pies,
Yeah.
and they make you sweet tea, and they do all that other stuff too
Fresh
on the side.
veggies
too.
in the summer.
Yeah.
That's right, that's right. You go home
Absolutely.
with a bag of potatoes or something. And just to speak to the area too, like if you're listening, you're not from this area, being that I was from New Jersey, kind of a different setting, so I come here because my wife's from the area, so I didn't know a lot about Fredericksburg. And I have to say the town itself is great. So there's a lot of, if you like Civil War stuff, there's a lot of history. There's a great downtown, lots of places to eat. That's like my favorite thing to do. So tons of great places for pizza and burgers and steaks. Like I said, my girls were little when we moved here, so we love the school system. They're now in middle school. I got one almost going high school now, so we're really excited about that. So if you're not from the area and those other variables, so we're like right in the middle of Richmond, So they have like the Flying Squirrels, which is like a minor league baseball game, and there's a lot of fun things to do there. There's DC, so if you like all that history. We're almost like right in the middle, like an hour in between Richmond and DC. So there's a lot to do here, and it's very family oriented, I find. So it's a nice place also if you have a younger family. There's the University of Mary Washington here. So there's other places too that are very accessible for family life.
So Susan, the question's for you now. Was it easy to make that transition from Canada to the U.S.?
Well, I did all my schooling in Canada because that's where I'm from, and had not actually worked up there. When I finished nursing school, there was a big transition, and nurses were actually getting laid off. Hospital beds were closing. A friend of mine from nursing school ended up in Syracuse, New York, and sort of recruited me and said, hey, they're hiring. They've got jobs in their oncology floor, which had kind of been my niche during nursing school. So I can't really speak to that transition, not having worked in Canada. But I have to say that my initial plan for anyone who may be considering coming here from Canada and thinking that I'll get a year or two experience and I will move back, that hasn't happened yet. It's been 25 years come November that I've been working in the U.S., given me an extremely successful career that I am ever so grateful for. And if you're interested in coming down, we would be happy to have you.
We're glad you stayed too. Susan.
Yes, we're very glad you
Thank you.
stayed. As your
That's right.
patients are very
That's
glad
right.
you stayed.
That's right.
All right, so, and I'll let each of you kind of give your take on the answer for this one. What makes MWHC Home Health stand apart from other home health agencies?
Who wants to start?
I'll start with that. I think we're very family-oriented. As a team, as associates, there are a lot of us that have been here a very long time. I've been here 30-plus years. I mean, it says a lot for our agency that people stay. We have a very deep-rooted staff that everybody comes and they stays, and it's kind of a little private joke, but we're just very, very nice.
Yeah.
Which goes
That's
a long
true.
way.
It does.
And I think too, very patient focused. I mean, the one thing that really draws me to stay here, to come here and to stay here, is that they're always about the patient first. And I'm not just saying that because I know sometimes that sounds like the politically correct thing to say, but it's really not. They're all about let's get the patient better, or whatever that means, and we'll define that if we have to work as a team, or we have to problem solve or troubleshoot to make it better for the future too. So you always feel like you're part of the process. It's not just like management telling you what to do. There's not all these like requirements that you have to do A, B, or C. I mean, you have that like in any job, but at the same time, they're really about, and I think that's why I have patients continually come back. So if they get their left total knee done, they say, John, I want you back for my right total knee, and then I get their hips. So I mean, we literally have people who do both their hips, both their knees.
Make them bionic.
That's right. and they request this, so that's kind of nice to hear someone say, you know, I'm getting my knee done, my other one's done in 6 months, and I'm going to make sure we get a hold of you. Can I ask for you? And they're like, absolutely. So it's kind of nice to feel that, and I think we convey that to our patients.
Absolutely, and I think, you know, our goal is really to, as Mary Washington's goal is to improve the health of the community, and I really feel like we strive for that. Again, just to reiterate what John said, it's a bit of job security, but it really is nice to have people request you when they need you again. I'm sorry that they're sick, but the fact that they trust us with their care and that the family trusts us with their care, you can't get that anywhere else. And I think we really exemplify the meaning of providing good quality care in this community, and we do it as a team. We couldn't do it without each other. We couldn't do it without our office staff. We couldn't do it without support staff. We really all enjoy what we do, and that's why we're still here.
And I think being a hospital-based agency too allows that type of staffing and resources, and allows us to, you know, give the care that we need.
Thank you. How long is the orientation for an RN who is looking to transition into home health?
We have a very thorough orientation process. You go to standard Mary Washington orientation, but then you come to home health and you will spend a good amount of time in basic orientation, but then you're partnered with a nurse for preceptor, and that nurse will competency you on everything before you are ever expected to go out to do anything on your own. And if you have a strong area but a weaker area, we make sure, we ensure that you're comfortable with whatever you need to do before we send you out. And it takes about 6 months orientation. You're not, it's a process. You will be with somebody 24/7 in the beginning, but then you slowly wean off on your own until you graduate and you're completely on your own. But our job or our goal is to make sure that you're comfortable and you feel safe, and also that you are safe with the patients and that you don't feel that you're just being thrown to the wolves, so to speak. And Susan's one of our preceptors, and she does a phenomenal job.
And a lot of it depends on how much experience you've already had in nursing, or whether you've had home health experience before. Your orientation, if you've had home health experience before, may not be quite as long as someone who's coming from an acute care setting, but we will definitely get you there.
As we wrap up for this evening, we have one last really good question to ask, and that is, what makes MWHC a great place to work?
Well, let's see. I've been here 30 years, so that ought to sum it up. I think Mary Washington on a whole, their goal is to improve the health of the community. That is their main focus. That is their main goal. It's not profit. It's not anything else other than to improve the health care of your community and to be there for your community. And I'm proud to say that I work for Mary Washington, because I feel like in this area, we're one of the few hospitals left that is very, to me, family oriented, and just not only the hospital makes home health feel very part of the organization, but they've got our back, we've got your back. So it's a very strong family feel.
And I think, too, you definitely feel like your voice is heard, that management listens and they respect, you can bring ideas to the table, and if you want to help implement something, I mean, they're very on board with that if it's for the benefit of the patient or for the organization. So you're not just like an employee that's showing up and they tell you what to do and you go home. They definitely help you help the patients, and you get to have your voice heard. So I really like that.
And I think, too, one of the things to bring up is our associate opinion surveys. I mean, these are held, they're anonymous. We are, asked questions about what we think of the organization as a whole, management, supervisors, and that feedback is taken seriously in order to make changes, to make employees, to make our associates happier. Listen to information about, is there a change in benefits we'd like to see? And they really do. They do hear our voices, and that is greatly important to the associates as a whole.
That's a good point.
Mm-hmm.
Thank you, guys. This has been a great conversation, a lot of great dialogue, and we want to continue the conversation. So on June 19th, we will be hosting a recruitment event in Fredericksburg, Virginia, specifically geared toward our home health agency. For more information, look at our career site at www.mwhccareers.com, and information about our event should be posted by the beginning of next week. Again, thank you for joining us this evening. We will be continuing our Facebook Live conversations starting again in August. So we will post information on our Facebook, and we hope you have a safe and enjoyable summer. Thank you. Have a good evening.